Welcome back. Happy New Year.
Our consulting rooms have looked the same for decades. Stethoscopes, BP monitors, pulse oximeters, reliable tools, yes, but medicine has advanced. Why haven't our diagnostic tools evolved with it?
Meanwhile, secondary care has embraced Point-of-Care Ultrasound, POCUS. It's already a core part of A&E, ICU, even medical school training. Yet, in primary care, barely on the radar. Why are we so far behind?
Let's look at that. Isn't that beautiful?
It is. It's small.
So we haven't yet used this device in our practice or attended any formal POCUS training, but today we're exploring the potential of the GE Vscan Air with Caption AI. It's a handheld ultrasound scanner designed for frontline clinicians like us, paired up with a simple iPad device, and it's amazing.
Yeah. So we've said it's a wireless handheld scanner, and it just connects to a smartphone or a tablet. So you get real-time images during your consultation. No need for a hospital referral or an extra appointment. Imagine how consultation changing that's going to be.
The reason we've chosen the Vscan is it's got a reputation for actually quite good image quality. It's got 2 probes on it, all built into one. So what makes this model stand out is the Caption AI, an integrated artificial intelligence system that guides you through the image acquisition. So it's, for an idiot like me, I can get a really good image. It helps to ensure that you're scanning the right area with the correct technique, and even auto-calculates ejection fractions during cardiac assessments, stuff like that. So it's pretty cutting-edge stuff.
So why should a tool like this belong in NHS primary care? Well, let's break it down. So, modernising care. Stethoscope, it was revolutionary in the 19th century, but today we can see what's happening inside the body, not just infer from sound. Convenience. Imagine being able to assess bladder retention, pulmonary edema, or even gallstones during your consultation instead of referring for delayed scans and having to risk stratify for what possible diagnosis you're missing. Enhanced clinical insight. So real-time imaging, you get objective data, it supplements your clinical findings, you can confirm or refute diagnostic suspicions, pretty much immediately. You reduce your uncertainty when you're making diagnosis. When physical signs are inconclusive, this provides direct visual evidence to support or exclude a diagnosis. And we're relying less on secondary care. We can rule out common conditions in-house, we can prevent unnecessary referrals, and deciding how urgent a referral is. We all know we're having to grapple humongously long waiting times, and this can help you make sure your patients get through that safely. We already use modern tools. We've integrated pulse oximeters, digital BP monitors, and ECGs. This just looks like the natural next step.
Yeah, absolutely. And beyond the clinical impact, there's a personal benefit too. It makes the practice of medicine interesting again.
Yes.
Adding POCUS into our workflow brings back a level of clinical reasoning and diagnostic depth that's often missing from modern general practice.
Yeah, between us we've got nigh on half a century of primary care experience.
Between us now?
Yes.
50 years?
Yeah, half a century.
Half a century.
But it can get dragging and it can get hard. And sometimes these ones are exciting, aren't they?
Absolutely.
They make you think, oh, wow, look at the impact I can have. So we're looking at sustainable structured POCUS training to complement, and we focus on practical everyday clinical questions that GPs encounter all the time. So respiratory systems, pulmonary edema, pleural effusion, pneumonia, abdominal pain. Is this gallstones? Is it cholecystitis? Is there a retention? Could this be an aneurysm, an abdominal aortic aneurysm? Is there a knee effusion? Is this a Baker's cyst? Am I sending them in for a DVT assessment? Cellulitis, an abscess? Renal, have I put that IUD in correctly? Is there hydronephrosis? So many questions you can quickly answer.
Okay, and these aren't complex hospital-level scans. They're focused practical assessments designed for primary care scenarios. And while we haven't personally used it yet, the ability to answer these questions during a single consultation could be, a huge leap forward for us.
And as we previously discussed, some of it is just the joy of consulting again. Knowing you're going to get it right and make a difference. But there are some barriers we need to talk about.
Yep.
So let's be honest. There are significant barriers to making this a standard tool in NHS primary care. So, cost. How much does this
It's about €4,000.
So,
there are other cheaper ones available, but this has got the quality.
That's a chunk of investment.
Yeah.
Some practices can barely afford your basic equipment. So how could this be funded? What about indemnity? If you do a scan and you miss something, what's that going to have an impact on your professional liability go up? Time.
We're already under pressure. Will this just become another unfunded responsibility? And is this another way of shifting secondary care work onto GPs without the adequate move of resources from secondary to primary care?
Those are all definite no-nos.
Absolutely. And these are valid concerns, but I can see the flip side as well. So, the AI, it's just a beautiful piece of tech, isn't it? It's just lovely. Look at it. It's painted. You see the AI support, the Caption AI system reduces the skill barrier by guiding you step by step. So even I can do it. You've got the cost efficiency, so earlier, more informed decision making could reduce unnecessary referrals and save resources in the long term to the system. But it has to also save primary care because primary care is underfunded. We've already made all the savings, and we don't want this to be another tool to save secondary care.
Yes, not another whipping tool to whip us work harder, work faster.
Absolutely.
So for me, it's just the excitement. Like I have some nursing home patients, and we know we're just not going to get them anywhere to get any investigations done. But this can give us answers and help answer questions the family are asking. And
from a professional satisfaction point of view, it's expanding our diagnostic skills and making general practice more fun again and more rewarding.
Yeah. So the heart of the issue really is, if primary care is going to take on more advanced diagnostic things like POCUS, there must be a genuine shift in funding from secondary to primary care. Not just people going around saying the same old spiel. Actions speak louder than words. And that's what we
Exactly. Without proper funding, tools like this risk becoming a luxury for a few practices, not standard across the NHS, which I would love it to be.
Yeah.
If we're expected to do more in primary care, the resources must follow. Remember, no funding means no reform. For all you policymakers out there, you can have as many pie in the sky ideas, but if there's no funding to actually implement it into primary care, and trust us, give us the money, trust us to do the right thing with it, and we will reform the system.
Yeah, and we already know that primary care is so cost efficient. I will deal with your mental health, your musculoskeletal problem, your pharmacy issue.
Invested in primary care equals £14 to the general economy of the country.
Yeah. So, the money makes sense. If you look at all the figures, it makes sense. What we need technology like POCUS belonging in general practice, optimizing assessments, optimizing patient care, reducing unnecessary referrals, raising the standard of diagnostics in primary care, and last but not least, stopping burnout in GPs who have been doing this for a long time.
But it needs to be properly supported. Without funding, without training, and a clear guidance on the indemnity issues, it risks becoming yet another underfunded demand on primary care clinicians.
So here's a real question, and this is one for the people who hold those purse strings. Should the NHS invest in POCUS for GPs? Should frontline care have the tools needed for faster, more confident decision making? Let us know what you think. Let us know your thoughts in the comments below, not just for the purse string holders, for anybody.
And stay tuned as well on some of our next videos. We're going to show this a little bit more in depth, show exactly what it can do after I have a little bit of training on it. So, your hands-on look at the GE Vscan Air with Caption AI. We'll test out its features and explore its potential with real-world scenarios. So we'll see you next time. Remember to like and subscribe. More videos to come.